So topic for today will be about psychosocial issues pertinent to lung cancer survivorship and with a special focus on stigma. I use the term survivors or survivorship. I'm referring to everybody after a diagnosis of cancer. So that's whether you're currently in treatment or have completed treatment, so regardless of treatment status. So a little bit about me. I've given a little bit of background, but I'm originally from Philadelphia, Pennsylvania, where I completed my undergraduate degree in the biological basis of behavior. And then after I graduated, I got to work on a clinical trial as a research assistant where we were testing the safety and efficacy of varenicline, which you might know as Chantix, for people who want to quit smoking following a cancer diagnosis. So as part of that trial, I got to serve as a smoking cessation counselor. And I was just really inspired and impressed by the resilience and determination of the patients that I counseled. I was just amazed at their commitment to quitting in the face of really difficult prognoses and treatment regimens. And it inspired me to want to better understand the factors that help people adapt psychologically to challenging experiences like cancer. So that inspired me to obtain my PhD in clinical psychology at the University of Arizona, where I studied psychological interventions to help people with cancer and their loved ones navigate diagnosis, treatment, survivorship. I then traveled to Charleston, South Carolina, where I did a focused clinical internship. A lot of the work I did was treating depression, anxiety, insomnia, chronic pain, and a number of issues among people treated at their health system. And now I am at Wake Forest, and I am in my postdoc role that I mentioned earlier. So that's kind of what brought me here. So my research in the broadest terms and my work as a clinical psychologist really focuses on ways to enhance quality of life after a diagnosis of cancer. Quality of life is really an overarching, multifaceted term that describes a person's overall life satisfaction. So that would be the ability to function in everyday life, physical, social, and emotional well-being. One of the frameworks that I've used a lot when talking about quality of life or understanding the factors that influence a person's quality of life is called the biopsychosocial model. And you notice the title of this talk mentions psychosocial issues. So I'm talking about kind of social and psychological aspects. So these are important components of the cancer experience that are sometimes overlooked. Understandably, the focus is often on the biological aspects of cancer, genetic predispositions, test results, treatments, side effects. But you're so much more, and your experience is so much more than just those factors. There's also psychological and social dimensions to consider. So in terms of kind of the social aspects, this would be things like your relationships and your community. For some, your work, that might be in the home, outside of the home. And as this group probably has experienced, cancer can have a really profound impact on your relationships, your roles, and your ability to socialize and engage in leisure activities. It can also introduce financial strain, costs of travel and treatment, not being able to work, or loved ones needing to take time off of work to provide care. So certainly there's a lot of social changes and social challenges that need to be considered when thinking about well-being of a cancer survivor. And while cancer can put a strain on our relationships, these relationships that we have can also promote wellness in the face of a cancer diagnosis. So having a strong network and good relationships can really help to buffer some of the negative impacts of cancer. And then some people have also described to me just kind of some unexpected kind of positives, like bringing together family and friends, having a deeper appreciation for one's faith or one's community. And the psychological aspect, being diagnosed with cancer inherently involves some psychological adjustment and adapting to a new normal and the uncertainties that come with that. So in this biopsychosocial model, you'll see the overlap of these spheres. So we recognize that all these aspects are connected and all contribute to quality of life and influence each other. So the social and biological changes associated with diagnosis and treatment impact our psychological well-being and vice versa. So some of the psychological aspects of cancer that I've been focused on treating and researching are, as I mentioned, kind of that process of adapting to a new normal. A lot of times that those changing social roles and changes to physical functioning, like increased fatigue, breathlessness, other side effects, that could be a tough thing to adjust to. And those changing roles may bring up some guilt, or sadness or grief. There's also a lot of uncertainty inherent in this process. So a lot of ambiguous results, kind of unknowns about the future, difficulty kind of planning and imagining that future. Something that is often called scanxiety, so a real increase in worry, anticipation, or fear around surveillance scans, as well as fear of progression or recurrence. A recent study of lung cancer survivors found that as many as 75% reported significant fear and uncertainty, and that fear of progression or recurrence was one of their top concerns. So when sadness and fear, I want to normalize that a lot of times people are worried when they come to me or meet with me about, whether that it's abnormal to experience the emotions they're experiencing. I think it's almost it's expected that you would experience that because it is such a challenging process. So a lot of times, just feeling more emotional in general, or having more fear, more worry, more sadness is very common. When sadness and fear last for a long time, or they're very bothersome or distressing, or they interfere with daily living, problems may be diagnosed as what we call an adjustment disorder, or it may be diagnosed as depression or anxiety. Sometimes depression or anxiety, have occurred before diagnosis, but come back or worsen following diagnosis. And it is important to note that depression and anxiety tend to be higher among people with lung cancer compared to other types of cancer. So depending on the study and how people have assessed depression and anxiety, those prevalences may be as high as 50%. And this is really in response to those changing social and physical circumstances, the uncertainty, as well as some of the unique challenges associated with lung cancer. So people with lung cancer tend to have a higher burden of symptoms, challenging treatment regimens, and stigma, which we'll talk more about. And one kind of lung cancer specific example is that for people who experience shortness of breath or coughing, that experience can feel, some of my patients have described feeling like they're suffocating, or like they're going, like they can't get breath, and that can trigger anxiety and panic. So it can create new problems or worsen existing problems. Another very common thing that I see in my work is disturbance of sleep or insomnia. So difficulty falling asleep, staying asleep, or kind of unsatisfactory sleep throughout the night. So some studies have found anywhere between 40 and 80% of lung cancer survivors experience some sleep problems. And these can be due to worry, breathing difficulties, pain, or medication side effects, just to name a few things. And then stigma is a somewhat unique experience associated with a lung cancer diagnosis. So in survey and interview research, many lung cancer survivors report experiencing some level of stigma. And this stigma experienced can contribute to depression and anxiety, and can influence social interactions. So again, thinking about that kind of biopsychosocial model, these things all have an influence on different aspects of life and quality of life. So first of all, what is lung cancer stigma? So lung cancer stigma is an experience, or stigma broadly, stigma can be applied to different personal attributes, but it tends to be an experience of disapproval, devaluation, or discrimination by others that's based on a personal attribute. So in this case, a diagnosis of lung cancer. And a lot of the judgment and blame that people experience is based on the misconception that lung cancer is always caused by smoking. For a lot of people, the association of smoking is bad, lung cancer is bad, is so strong that often that can be kind of conflated, and people can have negative reactions to hearing about the diagnosis. So even though tobacco use is the leading preventable risk factor for lung cancer, not all people who smoke end up getting lung cancer, and not all people with lung cancer have a history of smoking. We know that at least 20% of lung cancer cases have no known smoking-related risk factor, and yet the association between smoking and lung cancer is a major contributor to the stigma that people experience. So smoking stigma has, and a lot of the lung cancer stigma is related to stigma against smoking, which has evolved over time as the harms of smoking have become more widely known. So 1964, the Surgeon General published a report stating that smoking was the leading cause of preventable death and disease in lung and other cancers. And since this report, there have been numerous public health campaigns and policies to reduce the prevalence of smoking. And these have been very successful and have changed a lot of the social norms around smoking. So smoking used to be very prevalent, very socially acceptable. And now the prevalence has decreased, as well as, ability to smoke in public spaces. And so that's really changed how people interact with smoking and how familiar they are. And so while these changing norms are good from a cancer prevention standpoint, some of the messages that have been used in these campaigns have harmful unintended consequences of shaming people who smoke. So like I mentioned, that automatic association of smoking is bad comes up, but it's important to recognize that people who smoke are not bad. These campaigns may kind of reduce empathy for people who continue to smoke, including people who would like to quit but struggle to do so. So we know that smoking is not just a habit. Cigarettes are highly addictive, as are other products containing nicotine. And if it were easy to quit, then nearly everyone would have quit already. So taken together, these things can make it actually a lot harder to have productive conversations about smoking or interest in quitting for people who currently smoke. So there have been studies showing that people who smoke and are experiencing stigma are actually less likely to ask about ways to quit or to be asked about their interest in quitting. So again, these unintended effects are important to consider. And lung cancer carries some stigma because it's associated with the stigmatized behavior of smoking. So it can be seen by some as something that's under someone's personal control, even though we know, again, that smoking is not the only cause of lung cancer and that absolutely no one deserves cancer in the first place. Lung cancer stigma is a common experience, and smoking-related stigma impacts people with lung cancer, whether they currently smoke, previously smoked, or have never smoked. So one study found that 95% of people with lung cancer experienced some form of stigma. Often this shows up kind of with this knee-jerk response to hearing about the diagnosis, with the first follow-up question immediately being, did you smoke? And stigma also has even affected funding. So lung cancer gets fewer research dollars, especially when you think about it in terms of dollars per loss of life. Cancer receives a fraction of what other common cancers like breast or prostate cancer receive. So there's a broad kind of, in addition to the individual experience of stigma, there's a broader experience of stigma that exists. And even when others in your life don't directly blame you for your cancer, you may still feel a sense of stigma or stigmatizing attitudes. So lung cancer stigma is a layered experience. Kind of on the outer layer, we might think of what's called perceived or felt stigma. So these are interpersonal experiences that people may have encountering judgmental attitudes or comments from others. So again, that kind of did you smoke question be an example of that. This can also show up as institutional practices, as I mentioned, a lack of funding or attention. But then this perceived stigma or felt stigma may become internalized or incorporated into one's sense of self. So you may tell yourself that you did something bad or are a bad person, or you may have feelings of regret or anger about yourself. And these feelings can lead to greater distress. So often guilt, shame, and self-blame show up. Feelings tend to be strongest for people who still smoke or who previously smoked, but can show up in different ways. And internalization perceiving stigma can also lead to an impact on your social well-being. Often this shows up in terms of social constraints or social isolation. So people may limit who they can tell. People who experience greater lung cancer stigma also have worse communication with their health care providers. People may avoid or delay treatment or underreport symptoms or misreport smoking as a result of lung cancer stigma. Some research has shown that experiencing a high level of lung cancer stigma may limit someone's willingness to engage in support or advocacy groups. So there are a lot of consequences and kind of ripple effects from lung cancer stigma. So some of these consequences of kind of the combination of experiencing negative attitudes and social isolation may create a situation where other problems develop, such as anxiety, depression or depressive symptoms. Greater experiences of lung cancer stigma are also associated with experiencing more severe or more burdensome physical symptoms and worse quality of life, as well as, again, like I mentioned, loneliness or social isolation as a response to kind of experiencing these attitudes. So the natural next question may be, how does one cope with lung cancer stigma? And I'm sure that this group might have a wealth of information in terms of your own personal experiences and the ways that you've found to navigate this. And one of the biggest things from survey-based and interview-based research that's come up is that a lot of times coping with lung cancer stigma involves advocating for yourself. And self-advocacy can look a lot of different ways, like getting informed about lung cancer and aspects of care like treatment, symptom management, risk factors, and then actually taking that information and sharing what you know, talking to people about your diagnosis and the fact that lung cancer can happen to everyone or can happen to anyone. Also, you certainly don't need to waste your energy on strangers or people who aren't willing to listen. But in the case of a trusted person, if they act in ways that are harmful or hurtful, you can let that person know how their line of questioning makes you feel and kindly and firmly let them know that their assumptions are not helpful. And so this can actually help bring people into the fold by engaging, trusted folks like family, friends, or others. And lastly, I can't say this enough. Remember that no one deserves cancer. It's not your fault. Everyone with cancer deserves love, care, and support. In terms of interventions that have been researched to combat lung cancer stigma or to reduce the impact that stigma has on people with lung cancer and others, again, there's been some work showing that, again, kind of educating yourself and participating in advocacy groups, groups such as this one, for example, can be really, really helpful in combating lung cancer stigma. There are so many different ways to be an advocate, like I mentioned, gathering and sharing information, supporting others going through this experience, promoting research and funding, engaging in activities that can help shape policy. Whatever feels like a authentic and reasonable way to be an advocate can be helpful. And being visible and telling your story grows the support community for lung cancer. And the larger, more active, and more engaged that community grows, the more likely we are to move the needle on lung cancer stigma. There's also been some interventions developed to improve communication and relationships in order to combat lung cancer stigma. One of these interventions is a short communication skills training for healthcare providers in which they learn about ways to respond empathically when patients bring up negative emotional experiences, such as guilt, shame, or self-blame, and also teaches them ways to inquire about smoking status and to make recommendations for quitting in a way that is much more patient-centered and destigmatizing. So this has been shown, preliminary research, to be effective. That's one kind of emerging area. Another is interventions that help patients develop and use assertive communication skills during virtual and in-person clinic visits and in social situations in order to navigate some of those tough encounters or challenging encounters. And then there's also individual and group support for people experiencing lung cancer stigma. So participation in support groups that are focused on emotional expression, talking about emotional experiences can be very helpful in terms of combating some of the stigma around lung cancer. Engaging in, assuming it's empathically provided and sensitively provided, actually engaging in smoking cessation counseling or smoking cessation programs and quitting smoking have been found to decrease lung cancer stigma as well. And then individual and group therapies that incorporate elements of mindfulness and self-compassion have also been tested and shown to be effective in reducing some of the internalization of stigmatizing attitudes and the consequences lung cancer stigma. And one such intervention that incorporates mindfulness and self-compassion is what's called acceptance and commitment therapy, or ACT for short. This is a psychological intervention that tends to be delivered in individual or group therapy sessions. So it was developed for kind of psychological issues broadly, but I was involved with a team of colleagues at the University of Arizona in taking ACT and modifying it so that it would be effective in reducing stigma and its impact among people with lung cancer. So ACT, in short, don't have time to go into it in too much depth, but it really helps people live better lives by focusing on what really matters to them. So instead of trying to get rid of or suppress painful feelings and thoughts, ACT helps you develop a different relationship with those thoughts and feelings so that they don't interfere with the things that are important to you. So a lot of times the things that are bothersome or challenging in cancer are things that we cannot control or logic our way out of. So how do we then, create space for those things so that we can focus on what we can control and what really matters to us? So that's kind of the basic concept of ACT. And so we took those ACT resources and we adapted our sessions from them. Our intervention was 6 sessions in total, the first being education about lung cancer stigma and helping set goals. And these goals were basically developed by the patients themselves and informed by kind of what's important to them and what does stigma get in the way of. One session was focused on mindfulness, so being able to kind of be in the present in a non-judgmental way and recognizing and gaining distance from unhelpful thoughts and judgments that show up. Acceptance, so increasing the capacity to have and hold uncomfortable emotions and thoughts without pushing them away so that they end up interfering less in your day-to-day life. And self-compassion is a big one. So treating yourself with kindness, recognizing that you deserve kindness and care, kind of directly combating some of the internalization of stigma that some people may experience. And then values, clarifying and identifying what is important to you, and then committed action, finding ways, maybe new ways, different ways, depending on how things have changed for you since diagnosis, for you to live by those values. So this intervention, we've pilot tested it with 20 people, which is a small sample, but still meaningful. And we found that people had improved sleep, improved social connections, had a reduction in social constraints related to stigma, and a reduction in how much they internalized stigmatizing attitudes of others. So we found some promising findings, still need more research in this area, but this is something that showed good evidence. And also there are practitioners who maybe are not familiar with this specific intervention, but have some familiarity with ACT or with mindfulness. And so people taking those kind of approaches often will have, hopefully, a way to help manage and live with some of the challenging psychological aspects of lung cancer. So in summary, cancer diagnosis and treatment impact us on multiple levels, biologically, socially, psychologically. These factors can shape our quality of life, both in positive and negative ways. People with lung cancer may have especially high rates of depression and anxiety due to some of the unique challenges associated with lung cancer, high symptom burden and stigma. that lung cancer stigma is a common experience that may be internalized and can lead to self-blame and negative self-image, but that seeking support and being an advocate for yourself can help to reduce the impact that stigma has on your life. And with that, I would just love to hear, any questions you have or any experiences you'd like to share, either with stigma, with how you've coped with other challenges.
Hi, doctor. Thank you so much for your presentation. I was a former heavy smoker, found out I had extensive small cell a couple of months after I quit smoking, because as soon as I quit, the coughing started. The first time I walked up to a stranger to talk to them about lung screening, and the first question was, did you smoke? I was kind of offended, and I don't think I handled myself very well, because I was almost attacking, saying, have you been screened? Anybody with lungs can get lung cancer. Since then, over these last couple of years, I've learned to be very gentle with people. I've never had anybody turn their back on me. But what's the most interesting in my mind is now, when that's the first question I get asked, it's almost always because that person has just quit or is still smoking. So I had to learn pretty quickly how to go about answering that question, did you smoke? And I'm no longer ever offended by it, because, as you said, none of us deserve lung cancer. But I did send you a question about the medicine you mentioned for smoking cessation. Jeff, there was a woman at yesterday's longevity meeting, right, who is still smoking and beating herself up like crazy, relatively newly diagnosed. So my first thing was, all you're doing is putting more pressure on yourself. You're trying to quit. That's what's important. But this Tantex, what you mentioned, is that something that's available, and how do you actually spell that?
Yeah, so the Chantix is the brand name.
Oh, Chantix. Okay.
Yeah, Chantix is the brand name, and varenicline's the generic. I know there were some difficulties with manufacturing a couple years back where people were having trouble getting it, and so there was a Canadian version that people were getting, but I don't know if those supply chain issues have been resolved, but you can get that as a prescription from your doctor. Most oncologists or primary care physicians usually are fairly comfortable prescribing it. And again, it doesn't work for everyone, but for a lot of people, it works. And sometimes people even tried smoking while on it and found like, oh, wow, this really doesn't, cigarettes are no longer even enjoyable for me anymore. Or that's what I've observed in the trial. But, if varenicline or Chantix doesn't work or isn't an option because of a specific risk profile, patches are another option, nicotine patches, as well as Wellbutrin or bupropion. It's less effective, but can be an alternative for some people.
That worked for me. The Wellbutrin helped. But I was a heavy smoker also, and I quit January of 2008 when they told me I had lung cancer. So, but to this day, I still miss it. And I know that's really sick. Where I live, there's an area people can smoke, and I love to walk by there. Listen, it's been 16 years since I've had lung cancer, and I still miss the smell of it. I hold a pen in my hand sometimes. I'm on oxygen, so of course I'll never smoke again. But yeah, it's hard. But yeah, a lot of people do say, well, did you smoke? And, if I say yes, we'll say, well, so I kind of ignore them.
Yeah, I'm still doing.
Some of them just, they just keep on and on. I just walk away. It's easier.
Yes.
But I don't beat myself up anymore. I did for a long time. I did. And but Wellbutrin does help.
That's amazing that you were able to quit.
It wasn't easy. It didn't take the first. It took a couple of months. I would smoke one here or there. But yeah, that's what did it. Went to a new doctor, never been to her. She said, let's do a chest x-ray. I said, okay. And she found it.
I have kind of an opposite problem with the psychological handling of lung cancer. I am a 20-year person that's been living with lung cancer. I've been in treatments and everything for 20 years. Along the way, because I go to a lot of conferences and participate in the FDA panels, I've made a lot of friends. And what my issue is, it's so hard for me to deal with when they pass. So I'm outliving a lot of the people I've become friends with. And it's really hard. I feel so guilty.
I outlived my brother by 2. He died. I was diagnosed 2 years before him, and he just died a year ago. So yeah, it's still being around. There's been a lot that have died lately. That's the thing. There have been a lot. It's been 16 years for me, and I see people come and go. And it's hard. It is hard.
I'm glad you brought up that point. Survivor guilt is part of it. Being connected to a community has such amazing benefits of getting to know just a phenomenal group of people, but it also, there's sadness with that when you see people pass, you lose good friends and people who are, pillars of the community.
People ask me, well, didn't you smoke? I say smoking certainly is it can be a factor, but are you aware that the fastest growing group of cancer patients are never smokers with no other known risk factors?
So for you, kind of having that information available and sharing it with others is how you've handled that.
Yes.
I personally, my daughters had the hardest time with that when they'd be asked, especially my middle child. She said that she was going to throat punch the next person that responded with it. Did she smoke? But for me, I just have a really hard time with it. I'm definitely an advocate for lung cancer. I think that it's terrible that it has the stigma that it does. And I mean, there's a lot of other things that contributors to heart attacks and diabetes and blah, 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 all these other things. I think it's horrible. And I am a former smoker, but I have the non-smoking lung cancer because I've got ROS1 as a driver. And to me, it really shouldn't matter. Smoking is I absolutely, I can't stand the smell of it now. I just find it totally unappealing, but I just feel fortunate that I feel like that because, for so long, I remember how many times I thought this is my last cigarette, so I have so much empathy for people that smoke. And anyway, yeah, so this is a really hot topic for me because I feel very strongly about the stigma and how it affects the cancer, how it affects our funding, because we seriously the lung cancer kills more people than the next 3, and we get the least amount of funding, and it's ridiculous. I think we need to have a campaign that's like that has something to do with, lungs. They're what's under the boobies, something like that, because it's like, they might not be as pretty, but they're more important, actually.
I had quit 35 years before I got cancer, and they still would turn around. Oh, did you smoke? Hey, I'm 88. Yes, I did when I was young. Most people did in that era. We didn't know how bad it was for us. But I quit for 35 years, and then I got cancer, and they still say, oh, well, and even the doctors will do that. Oh, well, did you smoke? Oh, well, I mean, come on. And I get mad. I get mad when they do it. I say, come on, other things happen. There's a lot of people that have never smoked that got that cancer. And if I did I do it? It's my fault, right? Because I got it? Ooh.
Thank you, doctor, so much for the information that you shared. You hit so many topics, the stigma of smoking, the stigma of not smoking. I was listening to, it was on ABC News, where I was actually surprised that the word is getting out about lung cancer, and they focus this on there's more men that has lung cancer than women, based on their environment, based on if they smoke, drink. And I was so happy to hear that, even though it brought somewhat of a sadness, but I'm learning through being a part of advocacy groups, LiveLung, that advocating for myself is a plus. It's number one. But, you know, it's like if you're not in contact with somebody that have already experienced this, you don't know that psyche stuff that's going on in your head when you're diagnosed. You know, I just shut down for a little while, you know, didn't share, didn't do any of that. But moving forward, thank God I am a survivor. But the stigma is, will it return? But then when you know, and I'm also dealing with another area of my body on the left side of the lung, they're watching it. So, you know, I'll go into this small depression or sadness. It's like, then what? You know, I have not returned to work yet, but the stigma is like, okay, when I go back to work, what then? I mean, where will my focus? How do I handle my focus? How do I still handle going for CTs, you know, every 6 months, starting in October? So you hit so many areas, and I struggled to quit, you know, the Shantex, the Wellbutrin, smoking cessation classes, you know, and I still have a part of me that want to smoke, but no, that's not good for me. So I am advocating for lung cancer. Like Maida had said, well, you know, you may not always get really good responses, especially if you're new to this advocacy role. And I didn't get one good bad response from a family member, you know, just went totally into defense. And I just had to stop. You know, you have to learn when to stop talking about it, because the bottom line is you put it out there, you know, CT scan, you know, for early detection, whether you smoke, not smoke, been in an environment where there's all these fumes. And so I just thank you, you know, just for increasing our knowledge on this topic, because this is like so important. Everybody I meet now, you know, you have to get that feeling and courage, of course, to talk about it. Thank God I was in therapy before I was diagnosed. I think that's what really saved me. I was in therapy already. So it's like now, once I return to work, you know, sometimes you get the looks because I lost so much weight. Now I'm regaining some of my weight. You know, what questions do you know, you answer, or comments? So, you know, you put it out there, you know, really, really clear. And this is not something that we just stop doing and advocating and looking at our psychological and biological behavior. We have to continue to look at our behavior. We have to look at ways and means to continue to keep us feel better, that we are the best person that's ever, and don't beat yourself up. That's what I'm learning. I'm not quite there yet, but thank you again.
Somebody had mentioned about the frustration, and I share it as well as all of us do, is about the funding and discrepancies and what we can do about it. I just wanted to, I hope she's still on here. I think it was Cindy. I just wanted to let her know that there are groups that facilitate going to Capitol Hill in Washington, D.C., to talk to their representatives, senators, about increasing lung cancer funding. And they get you prepared with all of the talking points and everything else, as long as you're not scared to talk, which I'm not. And I've been there many times. But that's something that you can do that's important, and will make you feel like you're contributing something, because you are, to helping with research and everything that we desperately need, because we're the least in everything, and yet take more lives than breast, prostate, and colon cancer combined, which somebody else mentioned. So you might want to.
Oh, and breast cancer, Melissa. It's breast, colon,
prostate.
At prostate, and more of us die every year than all three combined.
Thank you for bringing that up, Melissa, because that is that is a very big cause for us as well as LiveLung. And LungCan, which is the Lung Cancer Action Network, which Dusty is the president of, watch for emails from us, you guys. I know that for some of you, it's not possible to go to DC, and it's not in your comfort zone too, maybe to go and speak to your reps. But we do give you opportunities to communicate with them and to let them know that you demand more lung cancer research funding. So watch for that, you guys. But yes, Go-To Foundation, they always have, or Go-To for Lung Cancer is what they are now. They always have the Voices Summit. I believe it's usually early March. So definitely, and I believe there are travel grants available, at least for the first time that you do this. Do this, you guys. It's incredible. I've done it a couple of times, and it gets easier every time. So do go to these things. Maggie, I love your cat, by the way. Okay, Jay, you have your hand up, please.
Yes, I just wanted to say that I don't understand. I mean, there's so many advertisements on television for, colon cancer and obviously breast cancer. I just don't understand why like the National Institute of Health, which they probably have figures and know that lung cancer is the leading cause of death for everybody, do a public service announcement. I mean, how much could that possibly cost? The cost of that is just, having somebody stand up and, do a PowerPoint presentation. So the cost of that, I think people should also advocate for doing, making the public aware through the National Institute of Health or whoever else does. I was going to say the FDA, but that's not right. But, to do that.
Yeah, that's a great point. I think a lot of stigma, some of the roots of stigma are a lack of information and a lack of visibility, and campaigns and concerted efforts, whether it be kind of these larger scale things that we're talking about or smaller scale, you just being a person who is visible to others, like that is making a huge impact. But yeah, even some of the pharmaceutical, not that direct to consumer kind of advertising for pharmaceuticals, I'm not promoting it, but just even some of those ads for lung cancer focused therapies did a lot to kind of increase visibility and change attitudes and reduce stigma. So something that's actually concerted and focused on information would be really powerful.
But Angie Donnelly, you mentioned that your doctor also blamed you. And Angie, would you mind sharing your experience? Because I thought this was incredibly powerful. Jumping into your own self-advocacy shoes. Angie did. She had help from her granddaughter care partner. But would you mind sharing, Angie, your experience?
I had gone to one of the doctors close by, so I wouldn't have to depend on anybody to take me far away. But we had a very bad experience. My oldest daughter went with me, and just to make a long story short, I mean, when we were done with it, we both looked at each other. I mean, he literally said to me, "You know what this caused. Your smoking caused this cancer." And then he had passed a remark as my daughter drives to the post office, so she's sitting all the time, and she was standing, and he passed a bad remark about that too, that she should sit down, she shouldn't be standing, so it was just a bad experience. But I was blessed because she knew a doctor that worked for UNC in the children's ward. He was in charge, and he was able to get us Dr. Weiss from UNC.
Thank you, Angie. Your audio was a little bit rough there, but basically her doctor told her, he said, you know is your smoking that caused this, and blamed her, sent her out. And thankfully, Angie and her family were like, this is not the doctor for me. But I think it's a very powerful story. And I fear that a number of our patients have experienced this from their medical provider. Denise, would you like to go ahead and jump in?
We're not done educating the oncologists yet either. It's only been maybe 2 years, but I have heard listening in one of the things in IASLC or I think it was World Lung anyhow, 2 doctors discussing how if a patient who has lung cancer tells them they didn't smoke, they know that the patient will lie to them about other things as well. And those were 2 preeminent, one of them was actually in a place of authority at IASLC, and I don't want to mention her name, or the doctor in the United States name.
Thank you, Denise.
From research, about half of people with lung cancer experience some form of stigma from a healthcare provider directly. So that is a very unfortunate statistic. And how, it's so important to have trust in your team and to feel that they are taking good care of you as a person. And if they are saying blaming or shaming things, that doesn't bode well. So certainly that advocacy of kind of recognizing, okay, I need to get separate care, is very understandable.
Well, Dr. Price, thank you so much for joining us. This was a very informative and wonderful presentation. We appreciate it. Thank you so much. Thank you.